On July 2002, they announced this big scare that they were stopping the study early because they saw an increased incidence of breast cancer in the women on their hormone therapy. That announcement was preliminary, but yet they made it to all the media outlets, and within weeks, all women were told to stop their hormone therapy abruptly. Pharmacies wouldn't even fill the prescriptions. What ended up happening to me is women somehow found my practice and were seeking out alternatives, and I was able to prescribe bioidentical compounded hormones for them. And so it was really the timing that forced me into above and beyond what I was imagining.
Welcome to the Deeper Healing Podcast. I'm your host, Danielle Howley. This is for everyone who's been dismissed, misdiagnosed, or told to just live with it and refuse to accept that answer. You're going to hear amazing patient recovery stories, raw and real in their own words. People who found answers after everything had failed them. You're going to hear from medical experts we trust that are pioneering new approaches to healing the body, because we deeply know we're designed to heal. Let's dig in. Hi, everybody. I am so excited to be here today. You're just incredible. This is Dr. Janine Blackman, and she is visiting from Florida. She's been up in Charleston on vacation, and she got to come to Deeper Healing, do some cleansing, and just really hang out with all of us. And you're amazing. So let me just give you a little introduction, and you're going to feel like you're such a slacker after you hear this, okay? She has a chemical engineering degree, and she has a medical degree, and she has a PhD. And while she was in medical school and her residency and her fellowship, she was also a single mother of 3 children. Wow, I'm feeling like a slacker. So a brainiac, and also just a go after my dreams and raise my kids, and really smart. So we are going to talk about a big old topic today, women's hormones, or maybe just hormones in general. We'll talk about hormones in general because she has such an interesting background. And I think you should go back to the beginning of
Sure.
even the early days. And how did we get to where we are now in 2026?
Sure.
Okay.
So I do have a chemical engineering background, and I worked as an engineer for about 5 years, and then I was ready to go into medicine. And there's a whole nother life story on why I made that decision, but that's not important today. So I entered an MD PhD program because I wanted a career in academic research, or so I thought. And I got my PhD in epidemiology and preventive medicine, and my mentor, and this is back in the 90s, really was a pioneer in hormones research for women. And yes, that was the days of Premarin and Prempro and bioidentical progesterone. Prometrium was also launched and in her clinical trials. And so she did all the studies that led up prior to the design of the Women's Health Initiative. That was a big snafu we'll talk about. She was not involved in that. But anyway, my PhD years were really well grounded in doing research in women's hormones and the benefits to our hormones in terms of our health and our long-term health. Fast forward, I'm going through my residency in family medicine, and then I go on to do a fellowship in integrative medicine and functional medicine. Largely that backstory, I realized that all the missing pieces in conventional medicine that I wanted to fill in. I went into medicine really wanting to study optimal health, and to my dismay, discovered that's not what's taught in medical school. So I had to add that in later. But anyway, I was doing my fellowship in integrative medicine, and that just happened to include training in custom compounding of all prescriptions, including bioidentical hormones. And that custom compounding is not something that's taught in normal medical school or normal residency programs. And so I was getting that training during this fellowship, just as one of many things I was getting training in. And that was the year in 2002 when the Women's Health Initiative came out with its erroneous results that we can confidently say were erroneous today. But on July 2002, they announced this big scare that they were stopping the study early because they saw an increased incidence of breast cancer in the women on their hormone therapy. And that announcement was preliminary, but yet they made it to all the media outlets, and within weeks, all women were told to stop their hormone therapy abruptly. Pharmacies wouldn't even fill the prescriptions. My own mother was on hormone therapy at the time and because she had to stop it immediately.
So this was like a screeching, like car crash, no more
Yes.
hormones. Women are in danger if they take any hormones.
Right. So all women were scared to death. The doctors were suddenly scared to keep renewing the prescriptions, certainly wouldn't start new ones. Pharmacies were scared to fill the refills. And what ended up happening to me is women somehow found my practice and were seeking out alternatives. And I was able to prescribe bioidentical compounded hormones for them. And so it was really the timing that forced me into a deep dive in hormone prescribing for women above and beyond what I was imagining for
Did
myself.
you realize immediately, like, wait, these results are not true? How did you come to that? I mean, now
It
everybody, it seems
Yes,
universal.
it was pretty obvious, when you could do the math and do the analysis that they were blowing out of proportion, and when you actually got to dive into the research and the study results, realized the increased incidence was only in the women that were given the synthetic progestin, it wasn't in the women given estrogen only, and yes, that estrogen only was Premarin, which is horse estrogen, which is not what we recommend today, but it really wasn't the bad player and was serving women better than nothing, which is what's happened to women since 2002. So very recently, the black box warnings were finally removed off of estrogen prescriptions by the FDA last November in 2025. But from 2002 to the fall of 2025, women were made to be afraid of estrogen, and so were doctors. And training on prescribing hormone therapy to doctors stopped also. You have all these graduating doctors from medical school and their respective residencies being told to be afraid of estrogen, don't prescribe estrogen, it's bad for women,
Cancer causing,
cancer,
um,
stroke,
all the
thing.
things.
Yeah,
Okay,
and
I mean, I'm sorry, my head's a little on fire because I'm like, wow, this only just happened in
yes,
November.
last November. It wasn't quite the same fanfare that happened back in July of 2002, buddy. Yes. So then all the doctors that, like myself, who have been prescribing usually some form of bioidentical custom compounded hormone therapy over the since 2002, were very alert to these warnings coming off.
So let's take it down to brass tacks. Let's just
Yeah.
say someone's out there and they're like, well, I'm not on hormones and I've always kind of like thought about it, but my doctor said it was bad. So, in your assessment, just straight off the rip, you're perimenopausal, you're in menopause. Should I be taking hormones?
Most of the time, the answer is yes. And
Okay.
let me explain why. That's a great question for, let's say, older women who've gotten through those maybe crazy years of hot flashes and sleeplessness, and they feel like they're kind of back to their new norm, whatever that is.
Right.
Let's say they're
By the way, that's me.
so yeah, so late 50s, so well menopause is usually by the early 50s, right? For most women. So, you're in your late 50s or even older, and you're like, well, I never used hormones. Why should I start?
I have
Well,
a lot of friends that talk like
yes.
that.
So I have women that come to me in that position. They may not be coming to me with hormone therapy. I have a comprehensive practice and they're just coming for a whole medical care. And I pick up, well, you're losing your bone density. You're losing your muscle mass. You're not really sleeping all that well, certainly not as well as you did when you were younger. And you're not disturbed with children waking you up at night, but your sleep quality still isn't very good. And and then if I bring up libido, well, then they'll all admit, well, no, it's not what it used to be either. And certainly, and I'll have some women say there's not enough KY jelly in the world to make it comfortable again. And so clearly the whole genital area is not estrogenized anymore. So it becomes dry and you lose your pelvic floor tone, you have more urinary leakage, and much older women start getting frequent urinary tract infections, not from frequent sexual activity, just because of the whole how thin the skin gets and how the natural estrogen actually maintains a good flora for the genitals and makes it more resistant to bacteria.
And a lot of people think just sexual function, sexual health with hormones, but you're saying no, it's way more systemic when you're talking about their
It's
bones and their
totally systemic. And let's talk about memory and brain function.
yeah, no, yes.
We know very much that women as a whole have higher rates of dementia. Most of that's due to lack of estrogen. And if you can stay on estrogen therapy, that you can negate that higher rates of dementia. Now, there can be other reasons for dementia or cognitive decline, most of which are also preventable and
Mhm,
reversible
mhm.
when caught early enough. And hormone therapy can play an important role in helping along and helping brain function. In fact, I've had many women in their late 50s still working full time, big careers, and they kind of got over the hump of whatever transition they went through with menopause, but their biggest complaint is their brain's not working and they can't remember anything. They're having to write everything down. Their assistants are having to double check them on everything because keep we can't retain information.
And what about skin? The reason
Oh,
I say that is I just have to tell this one
yeah,
little story. We had a patient come in
yeah.
here. She was 80.
Mhm,
And no, she came in and we were chatting and I was like, "Oh my gosh, she's so beautiful." And then I looked at her date and I was like, "Wait, it says she's 80. She's like 50." So I thought, this is wrong. Her birthday's wrong.
mhm,
So I said, "I think your birthday might be wrong in the system." And she was like, "Oh no, I'm 80." I was like, you're incredible." And I thought it was like
mhm.
plastic surgery. I don't know how you look that good at 80. Anyway, so I went in to talk to Dr. B and I said, "Whatever she did, I want it. Like, she is so beautiful at 80 years old." And he said, "That's someone who's been on 30 years of bioidentical hormones,
Yes,
literally. She
yes,
has maintained her youth, and it's not plastic surgery."
right,
I was like, "Sign me up." That was the final straw for
yes,
me
yeah,
because I never really had bad, menopause symptoms, and my mother never did either. But you'll get me on anti-aging all day long.
yeah.
And
No,
I think,
skin
who
health,
doesn't want that?
right.
Yeah, so talk about the
Yeah, no,
skin.
skin health is or estrogen just keeps our skin more supple. So and I've had women just tell me the first comment from their husband after they get on hormone therapy is, "Your skin looks better." And then they know it's working. If they're
Mhm.
not sure from any other reason, they're like, "Wow."
Vanity will get
Yeah,
you every time.
yeah, yeah. And
So,
hair, skin,
yeah,
hair. Yeah,
hair, skin,
yeah.
all over, holding on to your mind. So, okay, so yes, you wanna get your hormones taken care of, even if you're not symptomatic, right? I mean,
Right.
obviously, if you're suffering, I mean, I know lots of women who are suffering and they're like,
Mhm.
"I need help." Then the hard thing, I think, is, and I've had a lot of friends talk to me about this, they go to their OBGYN with their insurance card and they're like,
Yeah.
"Can you help me with my hormones?" What's going on there?
Well, today, most OBGYNs, since the black box warnings were removed last November, will prescribe hormone therapy.
Before that, no. Before 6 months ago, no.
They would discourage a woman greatly, and there were some hard rules. If you were over 60, no. Didn't matter if you were osteoporotic, just no. It was
What?
yeah, the guidelines early on were for the shortest time possible at the time near menopause, just to get over symptom management like hot flashes. And after the age of 60, you're not supposed to prescribe it at all. In fact, you're supposed to tell your women if they'd been on it to stop at age. And that was based on false analysis from the Women's Health Initiative that showed higher rates of heart disease in the women over 60. And it was believed that it was like if you didn't get started young enough on the hormone therapy. So, actually, that's another really important point. I'm going to switch gears
Yeah.
slightly. Women's heart disease, the natural history of women's heart disease is it generally doesn't start till after menopause with the loss of estrogen. Same thing with bone loss, but we don't get our hearts checked. Like coronary artery disease, it'll start younger if you have a strong family history or other risk factors that are creating it starting younger. But most of the time, because I'm in a practice where I do the imaging for plaque in the arteries, and most of the time, and I don't really start seeing it in women until their late 50s if they were not put on hormone therapy. Estrogen has a lot of healthy benefits to our vascular system and improving the health of the lining of our blood vessels. And so we don't put down plaque, but without estrogen, you'll start putting down plaque. So the Women's Health Initiative study was primarily only enrolled women over 60. So most of them had heart disease before they even entered the study
Oh, wow.
because they weren't allowed to have been on hormone therapy previously. That was a criteria to get in the study.
Oh,
So
wow.
you started with all these older women never exposed to hormone therapy. A lot of them had undiagnosed heart disease and no one knew it. Because that's the case around the world. No one's checking for plaque in the arteries until you're having chest pain or you're having a heart attack. So we don't check in the modern medical system
We like
until
to
it's
wait
too
till
late.
people are broken to do
Right,
things in
right.
our country.
And yes, so well, yeah, so how did we get on? I don't
I don't know,
remember, but
but
that
that's
yeah,
okay.
so preventing heart disease is another important reason to get on
Benefit
hormone therapy. But if you're over 60 and you haven't started it, it doesn't preclude you
from starting.
but starting, although any doctor is gonna wanna make sure your heart evaluation has been done by one means or another and feels like it's safe and that that's being addressed. If you do have underlying heart disease and that's being ignored, you don't wanna suddenly throw hormone therapy on without addressing the heart issue.
And what about I've heard this too many times and I know it's misinformation,
Mhm.
but let's just clear it up. What about it causes cancer?
No, and in fact, survival rates in breast cancer are better if you're on hormone therapy at the time of diagnosis than if not. So I tell all women when before I prescribe hormone therapy for the first time, I go, a certain percentage of us are going to get breast cancer. That's a fact. And none of us know who we are at this point when we're meeting. If it's going to be me, you, or somebody else, but the fact that you go on hormone therapy is not going to be the cause. It can happen to you though, and but your survival rates are better. You're probably healthier at the time of diagnosis if you're on hormone therapy. So it's not causal. There again, it was really the synthetic progestin that was probably the bigger player if there was really a increased incidence. It turns out that if you the reanalysis of the Women's Health Initiative, the comparison population, their control population, actually just had much lower rates than even the normal population. So it made the treatment group make look even worse. So
Oh,
there may not have even been anything real about
about
that
it.
breast cancer rates being higher, but we do have more recent research that shows the survival rates are
So it's astonishing to me. This is blowing my mind as just a regular person. Here we are, 2025, literally opening the door to women should take hormones. And here, the benefits are just massive. You're going to age better. You're going to look better. You're going to feel better. Your mind's going to be clearer. That's just the light switch. Yes, no.
yes, now.
Then it's what kind? How do I get it? Where do I get it? Who knows what the heck they're doing? Because I think what I'm understanding you saying is that we have generations of physicians, because this only happened 6 months ago, who have no training in women's hormones.
Right, and their back training is that this estrogen's bad, so that's still kind of in the back of their mind, and we're all having to reframe our thinking on that, and with that removal of the black box warning on estrogen prescriptions, with that removal, it didn't announce to the world, "Hey, estrogen's beneficial for women,"
You just
which would be another nice, good statement. It just took the black box warning off quietly
quietly.
away, no fanfare, so it's still up to women to, be on top of the topic for themselves, find a doctor who's open for it, have the conversation. Is it right for them? And
I can tell you there's a lot of confusion on this topic.
yeah,
This is a very important episode for anybody about women's hormones. I talk to so many women and they're like, I am literally so confused. I'm so confused about whether I even need to do it, want to do it. Where do I go for it? And then just to compound that, because I know Dr. B would want me to say it, his thing is, and all the hormone receptor sites are clogged from the toxins. We have a very toxic environment. So our hormones are very disrupted now, younger and younger and younger. And I think we do need to
right,
talk about that.
right,
Not just the girls, but also the boys. I've had a couple conversations with different urologists. They're like, we're not even going to have another generation at the way things are going. The boys' testosterone levels are pummeled. And the girls, like you said, it's less obvious. The boys, it's very clear. But we have an epidemic of hormone disruption,
right,
even in your prime. So now people are growing up not even normal anyway. So we don't even know what the causes are going to be as we're aging into it. I know for me, cleansing's been a huge part of just the journey that I've been on. But a lot of people haven't cleansed. I mean,
right,
Dr. B says all the time, one of the greatest things you can do for your health is sauna. And really, anybody that we're going to be putting on hormones, we are cleaning up their receptor sites first. So a big part of and that's also just getting the maximum efficacy out of anything is having your body be a clean receptor for that.
right.
So, and I always say this, and I mean, you can back me up.
Mhm.
This is Danielle talking. I'm not a medical person, but I can see enough when everybody's thyroid is not working. They're 40 years old and they're like, oh, I have this, I have that, I have Hashimoto's, hypothyroidism. Your thyroid's your master gland, right? And it's got all your messengers in there. And when it's off, ding, ding, ding. Why is it off? It's clogged from toxins. No one talks about that. No one
Right,
talks about that.
right,
So, but imagine if you understood that whole thing. It's like clean up yourself, get on your hormones, how much better we would age.
right. Yes, but you were mentioning the low hormones in men. for over 20 years in practice now, I've seen low testosterone in young men. So even 20 years ago, I would have 20-year-olds show up. They were otherwise healthy. I mean, it wasn't like they had had some major disease in their childhood and been treated with steroids or anything like that. They really had pretty much a normal childhood, and but yet, not quite feeling right, whatever that meant. And then I'm just doing a full hormone or full lab panel, and I check their testosterone, and it's really low. It's not even questionable low normal. It is rock bottom, and of course, you double check it. It's still rock bottom, and
I have to
it's
say,
shock.
because we treat children at Deeper Healing and teens, and it's quite literally an epidemic. We're seeing it in the boys. It's like universal and it's bad. It's really, really bad. The other thing that it makes them feel horrible. They feel horrible, but they don't know why. Dr. B always says they don't even know what it's like to
Right.
feel normal,
Normal, right? They've never
but
had a
they
strong
haven't had
testosterone.
a strong testosterone feeling. And as us moms, including myself, we don't know to check that. No one's telling us to check that. No one's even asking those questions.
Right.
So I hope that some moms out there who are like thinking about their own hormones are hearing this and say, wait a minute, I have a bunch of sons. We need to check their levels. It's a really important thing to know.
But also for young men, there are usually better solutions than testosterone replacement.
Ooh, talk
Like
about that. I like that.
I I I never want to prescribe exogenous testosterone to a young man, especially since they haven't started their family or completed their family yet. Because as soon as you do, you're going to turn off their signals to making sperm. And so their sperm count will go to nil. It's probably already low. If their testosterone is naturally low, their sperm count's probably going to be naturally low. But it's not zero. They're
So
still somewhat fertile.
yeah, so the
And
ideal
but if
would be like them clean up and then try to get their body to start
Making it their own,
making
right.
their own.
So there are medicines I can prescribe to stimulate their production, but that doesn't solve why it's not working in the first place. So you still want to do cleansing work because every young man or middle-aged man, when I show them their testosterone's low, they go, "Well, why?" They're they're otherwise trying to
Right.
take care of their health
No.
in the best ways they would know in a normal way, and they're like, "Why would my testosterone be low? I haven't been sick. What's the problem?" And there's really no answer other than environmental toxins that are interfering with the signaling and receptor function. And in fact, when I do give exogenous testosterone as prescribed for an older man who is low and it doesn't work, like they don't feel good on it, like because you should feel notable improvement pretty quickly for a man. And if they don't, I know where their receptors are blocked.
Mhm.
It's
Yeah.
an environmental blockage, and
And then,
they
I mean,
need to
they run
clean
the
it.
commercials
Yeah,
we've all seen the commercials for low
yeah.
T, I mean, all these companies are, and then I started seeing them advertised to the college kids, and I was like, "Wait a minute, they're literally advertising low T and Viagra to college kids. What on earth is happening?" Like,
That's so awful. Yeah,
it's
yeah.
crazy. No one's out there talking about the problem. This is such a huge, huge message.
And yeah, so that advertising, well, whoever's behind that advertising wants to make money selling the prescriptions. So and aren't really caring what would be the optimal way to help these young men. And it's certainly not prescribing exogenous testosterone and Viagra. Once you get a young man psychologically addicted to something like Viagra, they're never going to be able to function without it.
I
And
know.
and that's they shouldn't need it.
You combine that with the epidemic of
Yeah,
porn, and it is a disaster.
yeah.
We're gonna do a podcast on that. I have a really good
Mhm.
friend who is very deep diving into pornography addiction and young people because they have very sophisticated ways of pulling them, from YouTube or from their channels that they're watching into porn. Absolutely with the goal of getting them addicted. And then, oh, and guess what the ads are? Viagra and Lotte. So it is a quagmire for these guys to navigate. Okay, but we're gonna have a lot of women on here because we're gonna talk
Yeah.
about women's hormones. So let's go back to that. So this is what's sad, that we are still in 2026 and we are basically at the beginning.
We're at the
We're
beginning.
literally at the beginning of
And
women's hormones.
And we're getting inundated with telemedicine companies that are popping up, offering their version of hormone therapy to women and to men. But we'll stick with the women for now. And if you look at them, they'll have a product that they're promoting and selling and making money on. So mean, as a physician, I've always worked through pharmacies. I've never made money on the prescription, right? I just prescribe what I think is best for the woman, and whatever pharmacy seems to be the best one when it comes to whether I'm doing conventional prescriptions or a compounded prescription. But these telemedicine companies are offering their product that they've prepackaged, and they're going to try to fit you into that, whatever that is.
Correct.
And so what that means is they've got one thing in their toolbox and they've marked it up, or they've got it, they're buying it in bulk, they're marketing it up. So they're making money on that product and maybe offering a low discounted consult fee because they're making money on the back end. But it's one size fits all. I mean, there'll be a little bit of dose
Yes.
variation, but it's one product,
Your jar and you just take more or less of it.
right?
I've seen
Or
this.
your bottle that you're going to inject.
Correct.
And And so, what I like is to be able to tailor it for the woman. If I'm working with a perimenopausal woman where she's still making some of her hormones, just not full range, then there's going to be one approach I'm going to take versus a fully postmenopausal woman, a different approach, or a much older woman who's never been on hormone therapy at all. Then I'll have to start really low and I can, you know, tailor it to her and work up slowly because her hormone receptors are kind of starved or will be overly responsive just a little bit initially. But it's the ability to make changes and adapt it to a woman. And I in my career, I find women change themselves. Whatever was the right fit, maybe during her 50s, is no longer the right fit in her 60s because her life has changed. Maybe she's become more active or less active. Maybe
Mhm.
she's gained a lot of weight, lost a lot of weight.
Okay.
Maybe she's going through major life stressors with a dying parent. And when cortisol's going through the roof with stress, that also disrupts our hormones. So there's often need to adapt the prescriptions based on what's going on in a woman's life. And having the skill set to do that is really helpful. Or when you know you've got the things optimized and it's still not working, more detoxing is probably needed. And because maybe her microbiome's gotten all out of whack, and then that's affecting her hormone detoxification pathways. So there's a lot to look at, but having the ability to tailor it and not be locked into one model, not be locked into just patches versus pellets, which is another way of hormone therapy that for women and men that I don't promote, but it's out there.
Yeah. The practitioners here are like, no on the pellets,
No,
no on the pellets.
yeah.
I'm like, okay.
And then, topical compounded hormones can be really wonderful when prescribed well. And one of the other nuances that I like to let women know about is the concept of what I call physiologic or cyclic hormone therapy as opposed to static. So no one talks about the fact that the conventional hormone prescriptions across the board for women are static dosing. In other words, you'll be on the same dose of estrogen every day and the same dose of progesterone, either every day or only 2 weeks of the month. Or if you've had a hysterectomy, some doctors won't give you any progesterone. Never mind the fact that progesterone is good for your bones also and sleep also. It's good for us and our brains, but the old days it was the standard of care. You didn't weren't required to prescribe any sort of progesterone if you didn't have a uterus, because the whole point was to prevent the buildup of the lining. But anyway, so there are, the truth of the matter is, our hormones from the day of puberty, even after menopause, are cycling. Estrogen is low during our period, it spikes up really high levels around day 11, 12, 13. We typically ovulate around day 14 to 15 of a 28-day cycle. And then estrogen is sort of mid range between the low of our period, the spike before ovulation, sort of the second half of the cycle. It's sort of somewhere in between those two. And then it falls off. Progesterone doesn't even come out until we ovulate. So progesterone is very, very low the first half of the month or the first half of the cycle. And then when we ovulate, it's actually the egg that's released, the remnants of the egg that are producing that progesterone. So if we, for whatever reason, don't ovulate a particular cycle, we won't make any progesterone that month. Progesterone is just coming up and it's this slow rise and then a big peak and then falls back down if we don't get pregnant. So if we get pregnant, that egg is fertilized. It's that embryo that then forms and implants that ends up producing high levels of progesterone that keep the lining from shedding. Of course, high levels of estradiol too. And estriol, that's when when we're pregnant, we get several forms: estriol, estradiol, progesterone, and testosterone levels go through the roof. and we feel great when they're through the roof. I mean, once you're beyond the queasy days of the first
Yeah.
trimester, most women feel really quite rosy and healthy
Yes.
during pregnancy, right? And our hair gets really thick and we're really, really what glowing. So there is a way to prescribe the hormones to stay in that cyclic fashion. And the reason for doing that is that's what also keeps our hormone receptors functioning properly, keeps them interested. Our hormone receptors were always programmed to work
Designed.
that way. And
Yes.
the levels peak and then the hormone receptors come down, but then and downregulate and then they'll upregulate again. So there's a constant cycling and estrogen, the spike in estrogen is what brings out the progesterone receptors. So a lot of times when a woman says she doesn't feel well in the second half of the cycle, and she'll blame progesterone. Oh, I don't like that kind of the month. The second half, I don't feel good. It's because she's not getting that good estradiol spike. And so her progesterone receptors didn't come out and aren't able to respond properly to the progesterone. So when I'm working with a woman who's still cycling and she's not feeling well during her cycle, I have to really tease out and measure her hormones throughout the month to figure out what's really off. I can't just assume, oh, you don't feel well in the second half of the month. That means you don't like progesterone. Well, that's ridiculous. That, there's nothing about not liking it or your body not liking it. Of course, it likes it. It's just not responding properly because your receptors aren't primed, aren't ready.
And so that all makes sense, and then I think so there's a lot more of a nuance to it, and then I think of, like, I have so many friends that are, like, just on pellets. So that's, like, the flattest thing that you could ever have. Like, that's the opposite, right?
It
It's
is.
just
So
and you can't control.
what happens on pellet therapy is that you might feel great the first year or 2 years, but then over time, you'll go back to the doctor, say, "It's not working as well, let's go higher," and your doctor will step up the dose, and that'll kinda happen for several years in a row. You'll start just creeping up the until it's sort of maxed out, and your doctor go, "Wait a minute, I can't really go any higher."
Right.
There's
I've
yeah,
this.
and then you're
You're
like
in a trouble zone then.
yeah, and it's like, "Well, why do you keep needing higher doses?" It's because your hormone receptors are all downregulated from the constant high levels, and so it's
The
yeah,
titrating, it's, like, not
yeah, it's not
that
working.
so that
Um,
just makes sense.
yeah.
Like, you can like, anyone can understand that.
I mean, even with static dosing, not doing pellets, because you can't take the pellet out, it's in for 3 or 4 months,
Correct.
right?
Right.
If whether you're using a patch, whether you're using creams, if you're just gonna get static dosing, some doctors will say, "Hey, take 2 days off every now and then to give your body
Right.
let the receptors sort of refresh."
Correct.
And sometimes that can be a solution.
Okay.
It's a simpler way to
Yeah.
approach it. But the bottom line is, if you get on hormone therapy and you think it feels good, that's the first step. You're sleeping well, your sexual function feels really good, you're moisturizing well. The bottom line is your bone with a year later, is your bone density no longer decreasing? And then eventually is it starting to increase? Because if it's not, you're probably hormone therapy is still not strong enough. Okay. Yeah.
Right.
Your bone density and your muscle mass should be improving. Now, you should be exercising in there too, but it doesn't matter how much you exercise. If your hormones are really low, you're not going to build bones
Yeah.
or muscle.
That makes
Um,
sense. And then the environmental component,
yeah.
it can't be minimized. And of course, that's our, I want to say it's the drum we're beating,
Yeah.
but we're going to be beating it a lot louder because we have a true epidemic and a massive problem with hormones. And it is going to affect the future of humanity, like literally, quite literally.
Yes.
I want to thank you so much. It is so awesome when we have a visiting physician come to Deeper Healing. We've had a lot of doctors coming here very
Mhm.
interested in the environmental medicine component and how it's affecting everything else. I truly believe environmental medicine is the future of longevity medicine, of us aging well and having healthy babies. Literally, get cleaned up before you have your babies. We're going to do some whole episodes on fertility. That's a whole other thing. But I love that you came down here. I love that you got to see what Deeper Healing's doing. And I love that you got to try Rejuvenace. It's just
Yes.
like, it's so great to have that flood of oxygen.
Well, no,
Yeah, what did you think?
no, thank you, Danielle, for welcoming me. Because I just called up and said, "Hey, I'm going to be in town. I want to visit," and
Yeah.
it kind of opened up the clinic and let me observe and try a few things out.
At the end of the
It's good.
day, we need to spread this
We
environmental
do.
mission big time
We do.
because just like Hormones are just so misunderstood. There's so much misinformation. I feel like that's a whole category, just misinformation, and then very few practitioners who are really experts in that. And that needs to be like a mass re-education of medical professionals. It's the same with environmental medicine. Most doctors are like, I have no training in environmental medicine. I know nothing about mold. I know nothing about metals. I know nothing about chemicals, what to do about it. That's just how it is. There's just no training on it. That all needs to change. That all needs
Absolutely.
to change, and that needs to change quickly because we have a real big problem with humanity. But in the meantime, while we're working on those big problems, you can individually say, "Wait a minute, I want some hormones, and these are why you want the hormones." And share this episode with anybody who is misinformed. Dr. Blackman, the practitioners here, they all love to talk about hormones, receptor site cleaning, and literally the importance of that. And I guess I'm having my own awakening that this is brand new. I had
Mhm.
no idea the black box just came off 6 months ago.
Yeah,
Oh my God.
yeah.
It kind of seems crazy.
It's
Crazy.
shocking how long it took, and similarly, in the same month, they took the black box warning off testosterone prescriptions that for men too, and
Why would I never saw
yes,
anyone saying, don't do testosterone.
it's been on there also, and in fact,
What?
I've had a big battle over the years when I would recommend testosterone to a middle-aged or older man, they're like, "But my cardiologist says no because there's a black box warning." I'm like, "Oh my god." The heart's a muscle too. It benefits from testosterone. And the studies that made doctors scared of it was another flawed study. And abundant research and since then shows the benefits of optimizing testosterone in men. And the average levels of testosterone are falling by generation. And so finding what the optimal number is, I won't give a number. I said, we'll figure it out what it is for you as an individual when I'm working with a man. And, and the number itself doesn't necessarily matter if everything's optimized, which includes muscle mass and bone density for men. And in these young men, I'm diagnosing osteoporosis in 30-year-old men because of low
It
testosterone.
just makes sense.
Yeah,
I saw this thing. How labs are, they're averages, right?
right.
They're just like, we'll take the average population and we'll find an average. So our averages are getting weird. The
Yeah.
averages are wrong. I saw this thing. I forget where I saw this, but they were like, we went out into the bush, Amazon tribe in the middle of nowhere, and they did testosterone levels of these guys that have no environmental toxins. They're like literally not in the modern world whatsoever. They were in the thousands. They
Yes.
were, like, really, like,
Yeah.
testosterone men, and they were like, "This is what humans are
Right.
supposed to be."
Yeah.
I don't even wanna know what our averages are moving down to.
Yeah.
So that's another scary thing is, like, you're in normal range, when
Aiming for
normal
normal.
range might be completely crap right now
Right.
because
Yeah.
of this slide. So we're gonna try to tell the truth here on the Deeper Healing Podcast. We're gonna try to find the best people to talk about these topics and, share this widely, and we're here to help you live long, not be drooling at the memory care facility everyone's on the wait list for, and just have a great life. You can age well, and there's a lot of simple things you can do. So thank you, Dr.
You're
Janine,
welcome.
for being
Thank
here.
you.
This was
My
amazing.
pleasure. Thank you.
We hope this episode inspired you. Here's how to go deeper. Visit deeperhealing.com to become a patient. Online, we have loads of courses and a free toxin quiz. Subscribe and please, please share this episode with someone who needs it. It's always that one-on-one support that really gets people to find deeper healing. Remember, this is educational content, not medical advice. The information shared here should be discussed with your own personal healthcare provider. If you're excited by listening to the medical experts or the personal recovery stories on here and you want to start your own deeper healing journey, go to deeperhealing.com and start your process.